Assalamu alaikum everyone, welcome to my YouTube channel MediBuild Pro. I hope you guys will be fine and doing great and enjoying your good lives. So today we are going to continue our series of interview questions and answers. So in this lecture, today we are going to discuss all about the HIPAA compliance and regulations. So what is HIPAA, like the Health Insurance Portability and Accountability Act, and what are the different compliances and rules and regulations which can be asked while you're interview in medical billing. Okay, so this is quite an important lecture, so you guys need to memorize all these 15 questions. So this is the lecture number 7, and you guys need to pay focus on all these questions because these questions are going to be very crucial while you are interview in any kind of a position for medical billing. Okay, so without wasting time, let's start the lecture. Okay, so we are going to have our first question. So the first question is going to be the what does HIPAA stands for? As I've already mentioned that HIPAA stands for is going to be all about, let's see. Okay, so the option number 1 is going to be Health Insurance Protection and Accountability Act. The option B is Health Insurance Portability and Accountability Act. Option C, Health Industry Privacy and Assurance Act. Option D is going to be Health Information Policy and Accuracy Act. So what should be the question? What should be the answer of this one? So the answer of this one is going to be the option number B, that is Health Insurance Portability and Accountability Act. Okay, so this is quite an important kind of a rule which is being governed and which is being followed in US in medical billing. So if you are going to learn medical billing, then you guys need to focus on all these questions. ओके क्योंकि पाकिस्तान के अंदर भी काफ़ी सारी मेडिकल बिलिंग कंपनीज हैं. सो व्हेन यू आर हैविंग एन इंटरव्यू, जब आप लोगों का इंटरव्यू हो तो आप लोग ये सीरीज़ कंप्लीट देखें. ठीक है, इसके अंदर आज 7th लेक्चर है हमारा. सो यू गाइज नीड टू मेमोराइज ऑल दीज क्वेश्चंस बिफोर योर इंटरव्यू, एंड मैनी ऑफ आवर स्टूडेंट्स हैव सक्सेसफुली passed clear their interview. So if you are wishing or willing to join medical billing as a professional career, then you guys can go for it and you guys can memorize all the skills. Like यहाँ पर आपको मेडिकल बिलिंग रिलेटेड बेसिक कोर्स भी मिल जाएगा. ठीक है, आपको इसके साथ साथ क्या कहते हैं इंटरव्यू क्वेश्चंस भी मिल जाएंगे. मेडिकल कोडिंग का भी बेसिक कोर्स स्टार्ट कर दिया गया है. सो यू गाइस कैन जस्ट read out and you guys can learn all that kind of a stuff on my YouTube channel MediBuild Pro. Okay, so आगे चलते हैं. What should be our next question? That is going to be, why is HIPAA important in medical billing? So what are the different kind of importances of HIPAA rule in medical billing? Option A is it helps to increase patient visits. Okay. Option B is it provides tax benefits for healthcare providers. Option C, it protects patient privacy and secure health information. Option D is it ensures faster payment processing for claims. Okay, so let's see, why is HIPAA important for our USA healthcare system? So it protects patient privacy and secures health information. Yes, because if we are going to follow the HIPAA rule, then we need to secure that no one is going to have the access to the patient's health information except the authorized persons. So when we are going to shift the data, when we are going to transfer the data electronically, then we need to make sure that the members or the patient's data is secure and no one is going to have the access unless the person is authorized. Okay, so HIPAA compliance or HIPAA rules and regulations protects the patients and secures the health information of the patients. What is the question number 3? The question number 3 is going to be, which of the following is an example of PHI? Okay, so let's see. PHI means patient's health information. Option A is insurance policy number. Option B is patient's contact details. Option C is patient's medical history. Or option D is going to be the all of the above. So let's see what is our answer. The option D is the correct one. All of the above. Yes, patient's information like patient's health information, patient medical history, patient first name, last name, and all that kind of a stuff is going to be the patient's health information. Because when we are going to register a patient, then we are going to require and we are going to record all those kind of informations. Let's see, what is our question number 4? What does ePHI stands for? Encrypted personal health information. Option B is electronic protected health information. Option C, essential protected health information. Or option D is emergency patient health information. So E stands for basically electronic. So the option B is going to be the correct one, electronic protected health information. Like whatever kind of a patient's information we have, we are going to save that one, we are going to record that one electronically, and we are going to transfer that kind of a thing with the help of EDI, electronic data interchange. Okay, so for this kind of a reason, we are going to have these kind of informations, and that is electronic protected health information. Question number 5 is going to be, which action is not compliant with HIPAA regulations? Okay, so following are the options. So let's see, the option number one is logging out of billing system when stepping away, sharing patient information over unsecured email, accessing only necessary patient information, using secure passwords for system access. So which action is not compliant with HIPAA rules and regulations? So let's see what is the answer. So the answer B is going to be the sharing patient information over unsecured email. Yes, a person who is working in medical billing company or who have medical records access, that is not allowed to share the members or the patient's information with unsecured emails. Okay, so we need to have authorized email addresses, and we can share only information with the person who is authorized to have that one. So we can't share these kind of things with unsecured email or unsecured emails. What is the question number six? That is, HIPAA violations may result in which of the following penalties? Okay, so if there is a HIPAA rules and regulations violation, then what kind of penalties, that what kind of fines can be imposed on the person or on the entity who is going to do this one? Option A is verbal warning. Option B is fines and potential criminal charges. C, free training from government. D, none of the above. So what should be the penalties? I guess the option B is going to be the one. That is fines and potential criminal charges. Yes, government is going to impose different fines, and they are going to detain that kind of entity. They are also going to cancel the license of the provider as well. So these kind of things can be happen, and this is so serious kind of a thing. So whenever you are going to deal with different kind of a patient's health information, or you are working in a medical billing company, then you guys need to be focused, and you guys need to protect the patient's health information and follow the rules and regulations of the HIPAA. Okay, so the question number seven, what does CMS stands for in medical billing? What is CMS? Clinical Management Services. B is Comprehensive Medical Solutions. C is Centers for Medicare and Medicaid Services, or D is Certified Medical System. So the option C is the correct one. That is going to be the Center for Medicare and Medicaid Services. Okay, so they are going to help in different kind of rules and regulations which are governed by the USA government. Okay, so let's see what is our question number 8. What is the purpose of CMS in medical billing? So what is their purpose, basic purpose of in US healthcare? So let's see. A is to set reimbursement rates and establish guidelines for healthcare billing. Option B is to provide patient care directly. Option C is to handle only private insurance claims, or option D is to oversee clinical trials. So what should be the answer of this one? You guys can just let me know. Okay, I'm just going to tell you guys. So the option A is going to be the correct one, to set reimbursement rates. Okay, what kind of a reimbursements are the services a medical biller can charge, and what kind of a reimbursements an insurance company is going to reimburse to the provider who is going to provide different kind of a services to the patient, and establish guidelines for healthcare billings. So what should be the basic guidelines, and what should be the different kind of a guidelines which a healthcare insurance and a healthcare provider needs to adhere. So all that kind of a stuff is going to be uh, taken care by CMS. Okay, so we have a question number 9. Which of the following is considered a breach under HIPAA? Okay, so if there is a breach, then what kind of a things can be happen? Okay, so option A is accidental access of PHI, patient's health information, by an unauthorized person. Option B is encryption of electronic patient data, training employees on privacy policies, or D is going to be sharing information with the authorized team. So what should be the answer? That which of the following is considered a breach under HIPAA? Okay, so accidental access of PHI, patient's health information, by an unauthorized person. Like if the unauthorized person has an access to the patient's health information that needs to be secure, that needs to be confidential, then that is going to be the breach under the HIPAA rule. Okay, so the government or the concerned entity needs to take care of this one. What is our 10th question? That is going to be in the event of HIPAA breach. Okay, who must be notified? So whenever there is a breach in the HIPAA rule, then who needs to be notified, to whom we need to let the people know, or let the government authorities needs to be addressed. So option A is patient only. Okay, option B is the Office of Civil Rights. Option C is the patient OCR, Office of Civil Rights, and possibly the media, depending on the size of the breach, only the immediate manager. So option number C is going to be the correct one, that is the patient OCR, Office for the Civil Rights, and possibly the media depending on the size of the breach, like how much patient's data is breached. Okay, so for this kind of a reason, the patient should know about this kind of a breach, the OCR, Office for the Civil Rights, and possibly the media as well. So what is the 11th question? Which security measure is required for ePHI? Electronic patient's health information. So biometric access only. Option B is no protection as it's already secured. Option C is encryption and password protection. Option D is written permission from the patient for each access. So what security measure can be taken out or can be taken to secure the ePHI? That is going to be C, encryption and password. Yes, whenever the person or whenever the concerned authority is going to access this kind of a data, they should the data should be encrypted and there should be a password protection as well. The 12th question is going to be that how long must healthcare entities keep medical records according to the HIPAA? Okay, 1 year, 2 year, 6 years, 10 years. What is the possibility? So it's 6 years. Entity can keep the medical records of the patient for the 6 years. So next question is which of these statements is true about PHI? Okay, patient's health information. Option A is PHI only includes physical health records. Option B is PHI or the patient's health information can be shared without restrictions within the healthcare facility. PHI includes any data that can identify a patient and relates to their health conditions. PHI only applies to the elderly. Okay, so which of these statements is true about PHI? Let's see. That is going to be the C. Option C is correct. PHI includes any data that can identify a patient and relates to their health information. Okay, so PHI means patient's health information. Option, okay, so we have question number 14. What is required to access patient's information in a compliant manner? Option A is going to be proper training and authorization to view only necessary PHI. Option B is going to be approval from any coworker. Option C, access to entire patient record regardless of the need. Option D is none of the above. So what is required to access patient information in a compliant manner? So whenever we are going to follow the HIPAA rules and regulations, then what is the manner to access the patient's information? That is going to be the proper training and authorization to view only necessary PHI or the concerned patient's health information. So that is the proper training. So we need to give the proper training to the staff, and the authorized person can only access this information. So the last question of today's lecture is going to be the which type of information is not protected under HIPAA rule. So let's see. Option A is patient's social security number. Option B is patient's bank account information. Option C is de-identified health data. Option D is going to be patient's billing information. So which type of information is not protected under HIPAA? Let's see. So de-identified health data is not going to be included in the HIPAA rules and regulations. So all the above are also included over there. So this was all about today's lecture. We have just covered 15 basic and important questions regarding the HIPAA Health Insurance Portability and Accountability Act. So if you guys have any concerns or questions regarding this lecture, or you guys are confused that you should opt this medical billing field as a professional career or not, then you guys can let me know. I can help you and guide you in a better way. If you want to learn the basics of medical billing, then you guys can just go through my playlist. There are more than 50 basic lectures already uploaded, and you guys can learn for free this medical billing course. Okay, so inshallah we'll meet in the next lecture with different kind of a stuff in medical billing. And you guys have, if there is any kind of a question regarding medical billing, medical coding, okay, or you guys are concerned about the interview questions, then you guys can let me know. I'll get back to you as soon as possible, inshallah. So we'll meet in the next lecture. Till then, take care of yourself and of your family, and do remember me in your kind prayers. Take care. Allah Hafiz.